Many people make big mistakes with tooth sensitivity. Some even do the opposite of what actually helps. Today, I will share with you what sensitivity really means and how to recognize the early signs before it becomes a bigger problem. Most often, some of the hidden causes include recession, which is the most common thing people come in for, but you can also have grinding, there can be dietary issues, and also things like cracks in teeth or vertical cracks in teeth, which are a more serious situation to deal with as soon as possible. So when people brush too hard or they brush improperly, they can actually cause mechanical abrasion, and then they can develop tooth sensitivity, most commonly to cold. So let's talk about tooth sensitivity related to diet. Diet can play a big part, especially for people who like to do things like chew ice, chew really hard things. I had a patient who just came in who ate a Snickers bar right out of the freezer and broke his tooth. Those things are obviously serious to do, even though they taste really good. But it's not something that I would recommend because it can lead to bigger issues with the tooth. And actually sometimes tooth loss because of cracks and fractures in teeth because of related to diet issues. Diet can also cause sensitivity because if you eat too many acidic things, and that can etch the teeth, similar to recession, and that has to be treated because most often you wind up with cold sensitivity in the teeth. And so it makes it uncomfortable to eat when you want to enjoy your meal. And so if someone has early sensitivity, I want to see those patients as early as possible because it's better to be nothing than something. And the something can be even bigger than what a patient can imagine. You know, it may not just be recession that's treated by a sensitive toothpaste, but it could be something more serious, like a vertical crack in the tooth, grinding issues, things like that obviously are more intense to fix and also may lead to tooth loss if ignored. Any sensitivity that lasts more than 1 to 2 weeks should be checked by your dentist. Ignoring early signs of tooth sensitivity may lead to larger problems that the patient doesn't even realize. It's important if something like that starts to develop that you see your dentist immediately. By doing so, that can be diagnosed, whether it's X-ray, clinically, 3D scans, all of the above, to determine what actually is causing the sensitivity, whether it's just something simple as recession around a tooth, which is easily solved by using a sensitive toothpaste as the first line of defense, or it can be bigger things such as cracks in teeth, vertical fractures, potential beginning of a nerve problem with a tooth, and sometimes sinus issues which can mimic tooth sensitivity. Which path you take in treating tooth sensitivity is best determined by you and your dentist. The important part of tooth sensitivity is determining what the actual cause is. Sometimes it can be very difficult, and that's my job to figure that out for you, the patient. I take my time, I educate you as to what the issues are and the best possible course of treatment. I like being proactive, not reactive, which is why coming in earlier than later is always beneficial for the patient. And also a lot of times it can save a lot of extensive treatment due to waiting too long, and then it takes a whole lot longer and actually financially a whole lot more in order to restore your tooth. I personally am a very proactive person rather than reactive, and so that's how I like my patients to feel as well, which is why I spend so much time in educating them and nurturing them so that they understand what their dental conditions are and how to treat them for their general health and well-being. By waiting with issues such as tooth sensitivity, it can lead to bigger issues, longer treatment time, and actually more expense as well for the patient when it could have been avoided by coming in earlier when the first signs manifest themselves. Our practice is very nurturing and patient-centered and will always be patient-centered. So when you come to my office, you're my primary focus. I listen to what you say. I interpret what you're saying so that I can provide you the best care and the tailored treatment plan to address your dental needs and to give you longevity, good oral health, and good general well-being. If you have any questions, please feel free to include them in the comments. I'm here for you.